What if the very medications meant to help you were quietly stealing something essential from your life? Millions of older men across America are struggling with a problem they rarely talk about: erectile dysfunction. Most assume it's just part of aging. But what if that's not the whole story? Today, we're exposing the hidden link between common medications and your sexual health, backed by science. No gimmicks, no shame, just facts you need to hear, because the truth might be sitting in your medicine cabinet right now. Erectile dysfunction isn't just a private issue. It affects every part of your life. It can slowly chip away at your confidence, damage your relationships, and make you feel like you've lost part of your identity. For many older men, it becomes a silent struggle, something they endure instead of address. And the most frustrating part: you're doing everything right. You take your meds, eat a little better, try to keep moving. But the spark isn't there anymore, and no one warned you this could happen. The reality is, over 30 million men in the US deal with some form of ED, according to the American Urological Association. And for men over 60, the numbers jump dramatically. But despite how common it is, most never talk about it, not even with their doctors. Why? Because we're taught to believe it's just aging. We're told it's normal. But here's what no one tells you. A significant number of prescription medications, especially the ones commonly prescribed to seniors, are proven to interfere with sexual function. Not maybe, not possibly, proven. And we're not talking about obscure drugs. These are medications you or someone you know is likely taking every single day, often for years. High blood pressure, depression, pain, prostate issues. The usual suspects. This matters because you deserve to know what's happening inside your body. You deserve the full picture, not just a prescription and a handshake. If you've been blaming yourself or simply chalking it up to getting older, it's time to reconsider. Because it might not be you. It might be what's in your pill organizer. To understand how medications can impact your sexual health, we first need to understand how erections actually work. It's not just about arousal. It's a complex process involving your brain, your nerves, your blood vessels, and your hormones. When everything is working properly, these systems communicate seamlessly. But when something interrupts that communication, problems start. It begins in the brain. When you're sexually stimulated, your brain sends signals through the nervous system that relax the muscles in the penis. This allows blood to flow in quickly, filling two chambers called the corpora cavernosa. As these chambers expand, the penis becomes firm. Valves then trap the blood inside to maintain the erection. But here's the catch. If there's a disruption in blood flow, nerve signaling, or hormone levels, the entire process can collapse. And this is where medications come in. Many prescription drugs, especially those used to manage chronic conditions common in older adults, can interfere with this delicate balance. For instance, blood pressure medications can reduce the force of blood flow, making it difficult for the penis to fill and stay firm. Antidepressants may alter the brain's chemistry, reducing libido and blocking orgasm. Pain medications like opioids can suppress testosterone, which is vital for sexual desire and performance. Even medications for prostate issues, intended to help men, can unintentionally cause erectile dysfunction by interfering with nerve responses or altering hormone levels. This isn't speculation. It's science. According to the Mayo Clinic and the Cleveland Clinic, several classes of medications have been clinically linked to sexual side effects, especially erectile dysfunction. These include beta blockers, SSRIs, thiazide diuretics, opioids, and more. In fact, the National Institutes of Health has documented that up to 25% of all ED cases may be caused by medications. So, why does this happen? Some drugs constrict blood vessels, others block nerve signals. Some interfere with the hormonal feedback loop that tells your body to produce testosterone, and in many cases, it's not just one drug, but a combination, creating a perfect storm. Let's not forget polypharmacy, which is common among seniors. That means taking multiple medications daily, sometimes 5 or more. Each drug may come with its own list of side effects, and together they can compound one another's impact. The result? Fatigue, loss of libido, and difficulty achieving or maintaining an erection. Doctors don't always connect the dots. They're treating your heart, your blood pressure, your mood, but not your bedroom performance. And often, you're left wondering if it's just you. It's not. Understanding the science behind erections and how medications can disrupt it is the first step toward taking back control. You're not broken. You're not too old. You're likely dealing with a body that's trying to function while under chemical pressure. And now that you know how medications can interfere, it's time to look closer at exactly which drugs are most often responsible. Not all medications cause erectile dysfunction, but some are far more likely to interfere with your sexual health than others. Let's break down the 7 categories of prescription drugs most commonly linked to ED. These are all widely used in the United States, particularly by seniors. Each one has solid scientific backing, and knowing what to look out for can help you have an informed conversation with your doctor. First, SSRIs and SNRIs, commonly prescribed antidepressants like fluoxetine, sertraline, and venlafaxine. These drugs alter serotonin levels to stabilize mood, but often lower libido, delay orgasm, and impair erections. Second, beta blockers like atenolol and metoprolol. These medications reduce heart rate and blood pressure, but they also slow blood flow to the penis and mute sexual stimulation. Third, thiazide diuretics, water pills like hydrochlorothiazide. These lower blood pressure by reducing fluid in the body, but they also reduce blood flow to the penis and contribute to ED. Fourth, 5-alpha reductase inhibitors like finasteride or dutasteride. Used for prostate enlargement or hair loss, they reduce DHT and have been linked to persistent sexual side effects even after stopping the medication. Fifth, opioids like oxycodone and hydrocodone. While effective for pain, they significantly suppress testosterone levels over time, reducing both libido and performance. Sixth, antipsychotics such as risperidone and olanzapine. These block dopamine, reducing sexual motivation and pleasure. And finally, chemotherapy and corticosteroids. Drugs like prednisone can suppress hormone levels and damage blood vessel function, both of which are crucial for erections. The important thing to remember is that these medications aren't inherently bad. Many are essential for treating serious health conditions, but when you're not warned about their impact on your sexual health, you're left in the dark. If you're taking one or more of these medications and have noticed a decline in your sexual function, it's not your imagination, it's not just age. It's chemistry. Let's make this real. Bill, a 68-year-old retired firefighter from Ohio, started taking blood pressure medication after a mild stroke. Within a few months, he noticed his energy dropped, and so did his confidence in the bedroom. At first, he blamed stress, then age. It wasn't until his doctor switched him to a different class of medication that things began to improve. No one had told him that his prescription could be the problem, and Bill isn't alone. According to a 2022 study published in the Journal of Sexual Medicine, up to 25% of men over 60 taking antihypertensive medications report symptoms of erectile dysfunction. Another report from Harvard Health notes that SSRIs, among the most commonly prescribed antidepressants, are linked to sexual dysfunction in 30% to 70% of users. But here's what's even more telling. Most men never report it. Why? Because they're embarrassed, because they assume it's just part of getting older, or because they don't know there's a connection at all, that silence has a cost, a real measurable cost. Relationships suffer, self-esteem takes a hit, and most importantly, solutions get delayed. These aren't isolated incidents. These are patterns, repeated across the country in doctors' offices, pharmacies, and living rooms. But the good news is, once you recognize the pattern, you can start doing something about it. So how do we change the outcome? It starts with knowledge, but it continues with action. And that brings us to something many doctors don't say out loud, but should. Doctors have one job above all else: to help. And most of the time, they do. They prescribe medications to lower your blood pressure, balance your mood, ease chronic pain, and treat your prostate. These prescriptions can save lives, extend quality of life, and prevent serious complications. But here's the issue. In the rush to treat the condition, they often overlook the side effects that impact your quality of life, especially sexual health. Many men report that their doctor never mentioned erectile dysfunction as a possible side effect. It's not out of neglect. It's usually due to time constraints, clinical focus, or the assumption that the patient either already knows or won't care. But when you're over 60, intimacy and connection can still play a big role in your overall happiness and identity. The other side of the problem, many older men don't bring it up either. They may feel uncomfortable, ashamed, or unsure how to start the conversation. Some think it's just the price of aging. Others worry it'll make them seem weak or less of a man, so what happens? Nothing. The patient suffers in silence, and the doctor assumes everything's fine. The medication continues, the relationship suffers, the confidence erodes. This communication gap is one of the most overlooked problems in senior healthcare today, and it's a gap that only gets wider with time unless you speak up. The truth is, doctors can't fix what they don't know about, but they will listen if you're willing to ask. And now that you understand the link between medication and ED, the next question is, what can you actually do about it? So now that you know the truth, what can you actually do? First, don't panic. You don't need to throw away your medications or stop taking anything cold turkey. In fact, that's the worst thing you could do. Instead, here's a smart, science-backed approach to taking back control of your sexual health without compromising your overall well-being. Start by making a list of every medication you're currently taking, including over-the-counter supplements. When you meet with your doctor, ask one simple but powerful question. Could any of these be affecting my sexual health? That one question opens the door. Your doctor may be able to switch you to an alternative with fewer sexual side effects, adjust your dosage, or even change the timing of your medication to help minimize the impact. But none of that happens unless you speak up. Medications may play a role, but they're not the whole picture. Lifestyle choices are deeply connected to erectile function. Regular exercise, especially walking, swimming, or light strength training, improves circulation and boosts natural testosterone levels. Diets rich in leafy greens, berries, fatty fish, and nuts support cardiovascular health and nitric oxide production. Cut back on sugar. Excess sugar leads to insulin resistance and inflammation, which damages blood vessels and disrupts hormones. Sleep well, 7 to 8 hours a night. Poor sleep lowers testosterone and weakens erection quality. And manage your stress. Chronic stress raises cortisol, which blocks testosterone and reduces libido. Even mindfulness or simple deep breathing can make a difference. Some natural supplements have shown promise in supporting erectile function, but always talk to your doctor before adding anything new. A few worth mentioning: L-arginine, which boosts nitric oxide; Panax ginseng, also known as herbal Viagra; zinc, which supports testosterone; and maca root, used to increase libido. These are not magic pills, they're tools, and they work best when paired with a healthy lifestyle. Men can, and should, Do pelvic floor exercises, also known as Kegels. These strengthen the muscles that control blood flow to the penis and help maintain erections. Identify the right muscles by stopping urination midstream. Practice squeezing and holding for 5 seconds, then release. Do this 10 to 15 times, a few times a day. It's simple, free, and supported by research. Track your progress. Note changes in how you feel, your energy, libido, and performance. Keep a simple journal or even a note in your phone. When something improves or gets worse, you'll have real information to bring to your doctor. Now let's talk about what not to do. Never stop taking medications on your own. Suddenly quitting blood pressure meds, antidepressants, or painkillers can cause serious health problems. You must work with your doctor. Don't fall for internet gimmicks or miracle pills. If it claims instant results with no risks, it's probably a fake or dangerous. Many of these products are unregulated and contain hidden ingredients. Stick to trusted sources and clinical evidence, and whatever you do, don't stay silent. ED is nothing to be ashamed of. It's common, it's manageable, and it doesn't define you. Let's be clear, aging does not mean giving up on your sexual health. This stage of life can be a turning point. A moment to take back control and realize that feeling connected, confident, and fulfilled isn't a luxury. It's your right. Sexual health is about more than performance. It's about closeness, confidence, and quality of life. If those things are missing, the solution isn't silence, it's action. Whether the issue is your medications, your lifestyle, or just outdated beliefs, it can be addressed. With support, knowledge, and a willingness to speak up, you can rediscover joy, energy, and connection. This isn't about chasing youth, it's about owning your future with strength, clarity, and purpose. If this message resonated with you, don't keep it to yourself. Leave a comment below. Have you experienced changes in your sexual health after starting new medications? What did your doctor say or not say? Your story could help someone else feel less alone. Share this video with someone you trust. These conversations are long overdue, and the more we talk, the more we empower each other. Subscribe to this channel for more life-changing health insights, backed by science and focused on what really matters after 60. Because this isn't just about surviving, it's about thriving. Let's stop pretending this part of life doesn't matter. It does. You're not too old. You're not broken. You're not done. You're entering a new chapter, one where your voice matters, your choices matter, and your health is worth fighting for. And it all starts with a question, a conversation, and a commitment to yourself. We're here for the journey, and we've only just begun.